Hello, I am in a bikini top, which means that it is time for my second booby vlog. Excuse my voice, I haven't really talked to people yet today because it is currently 7:27 in the morning. So all I've talked to is my animals, so excuse the raspiness. But yeah, so I actually had, today is the 25th. I had my PreOp appointment on the 17th, so about a week and a day ago, and my surgery is in 6 days, and I am so nervous and excited. I keep getting told by people that I know that have had breast augmentation surgeries done that it's like a really easy surgery, especially since like I'm not getting like a lift or anything in congruence. Sorry, my cat is like playing with my foot. I'm not getting like a breast lift or anything along with the breast augmentation. It's just the augmentation itself. So it should be pretty simple surgery, pretty simple recovery, all that jazz. I forgot to go rewatch the first one, so if I repeat any information from that one, I'm sorry. And if you want to hear any information that I don't say in this one, you can go, and the link will be down below to go watch the first one. First one? I don't know, whichever way. You can go watch it there. Let's see. So I'm still going with the 700cc implants, which should put me up to about a 34 double D from the 34A that I currently am. Let's see. What did we go over? She is gonna do under the muscle. She told me, the nurse told me, she's like, it's no problem at all. Like, when I told her, I was like, my brain is like not, like, my brain does not understand the fact that like an implant that big could go underneath muscle that hasn't been like stretched out yet. And she was like, don't worry, like he's done way bigger. 700's no problem. So I was like, all right. Let's see, they took my photos for, to use in surgery and to use in as the before photos if they decide to put my results up on their website. They just do one where you're standing straight, one with your arms up, and then one's to the side. They gave me a, actually let me go grab the little papers that they gave me real quick. Okay, so I signed some paperwork, consent forms, all that jazz. I got a little instruction pamphlet it just has some info on different things. Up here is talking about like what saline implants are, but I'm getting silicone, but all the rest of the information is still the same. It gives me any risks that I could possibly have for like nipple sensitivity or any possible problems with breastfeeding, which should not be a problem for me. Any like alerting me about any cosmetic complications, infections, talking about how like mammograms can be more difficult because the implants can hide the any lumps or anything, I guess. And it just says to request the Eklund technique, which might be like an older way that they did breast exams before all this imaging technology we have now. I don't know, I haven't looked it up. Tells me what I can expect after surgery, extra fullness, numbness, itching, blah blah blah. Says my breast might look strange and square for up to 6 weeks. Tells you reasons why I should call a doctor, fever, blah blah blah. It tells me when the future visits will be. So my first visit is a 1-week checkup, which is I already have the appointment set actually. My post-op appointment is on the 7th at 10 o'clock. And then it says the second visit will be 2 to 3 weeks after surgery to remove sutures as needed, and a checkup with Dr. Metz, who is my plastic surgeon. Third visit is 1 to 3 months after surgery for checkup and the after photographs. And it says future visits, we like to see you on an annual basis or if you ever have any questions. And then it gives me also a little info for like day of and like thing. So it says like, you'll be in surgery center for 3 to 4 hours a day of surgery. They told me about 3. They said it's about an hour for pre-op, an hour for the surgery, and then an hour for recovery before I can go home. And it says that they give me the antibiotic when I get there, no lotion, the creams, the day of surgery. He does not recommend massaging the implants, which I have read from other doctors as well, because I hear it's the same way where some doctors say that you shouldn't wear, like some doctors just don't want you to wear bras at all. Some doctors, like I know my doctor hasn't recommended me, but there's some doctors that will recommend like a compression strap to go over the boobs if the boobs are rating really high. And some doctors are like, well, if the surgery's done right, you shouldn't need those. Like you should actually be putting the implants pretty much where they need to be. So I know someone else that was not recommended to massage her implants, and she still did a little bit. So I may or may not, I don't know. Because I also hear it's just to like help the muscle, whatever. And then it puts in there that breast implants are not considered lifetime devices. It's likely you have to go implant removal with or without replacement at some point during your life, which I already know. They say it's usually about 10 years from what I read, from what I've been told by other people, my doctors. It's usually about 10 years that you should start like thinking about it. But people who take care of their implants can go like 15 to 20 years without having to worry about replacing or removing their implants. So there's that. Sorry if I'm like super out of frame. I'm like putting the viewfinder up so I can't see. They also gave me this little brochure for a warranty program because I'm getting silicone. Honestly, I haven't read this too much yet. So pretty much it covers if the shell integrity of the implants is bad or whatever, so the implant ruptures. So it covers that if that happens. I think it says it's for how many years? So it's a 10-year warranty. It's free to me because I'm getting the silicone. It's up to $3,500 lifetime replacement for deflation or rupture, lifetime replacement for contralateral implant. So that's interesting. I just filled out the form and I turned it in. And whatever. For medications they prescribed me, I was prescribed pretty much Valium for it's a muscle relaxer if you've never taken it. Percocet or oxycodone, and Zofran, which is for nausea. And some people, they only give, how many pills are in here? Like 7? I think there's 8 pills in here, so it's like it's only for if you get nauseous, because some people do. The nurse says that taking one of those like stops it like almost immediately. For my doctor in particular, I don't think, because I know some doctors send you home with some sort of wrap or surgical bra, but mine is having me bring a sports bra in with me, so I don't think he does. I know not all surgeons do it, so I guess my surgeon's one of the ones that just puts you straight in a sports bra, which I'm totally cool with because I hear the surgical bras can be really uncomfortable. So I just got one from Walmart. It's just from the Danskin Now brand, and it's just a zip up one. So whatever, because you want to wear obviously nothing that's super tight and goes over your head, because you may or may not be able to actually get it off. I have seen a lot of complaints because I was worried about what bra to get, because like some sports bras that are zip ups, I hear like the zip has a hard time staying up, but I also wonder, I don't know, like zippers lock, or at least especially this one does. So I don't know if they just don't know that they lock, or maybe like the boobs are so big that it can't lay down flat to lock. I don't know. But anyway, I got that. And then because I have to live in a sports bra for, I think she said like 4 weeks, I was going to shop online for a sports bra first, because like I always knew, I'm used to, one of the reasons that I'm going the size that I am is that I can actually find shit in stores. Because the size I am now, it's always so hard to find any like bras that fit, and like sports bras that fit. So I ordered one online, and then when I went to go pick it up in store, I picked this one up at the same time. But the one I ordered online to wear like in between when, like while the other one's getting washed, which, first of all, why are like, I feel like this is a sexy sports bra, and I don't know why that's a thing, but this is just another front closing sports bra. This one is a clasp, it's like a front hooking bra, and it has a like deep plunge neckline. I don't know why that's a thing, but this is just gonna be the one that I wear while the other one's in the wash, at least for a while. I think this is the same brand, or this is, I think I tore the thing off already. I think it's also Danskin. Oh, duh, it says it right here. It's Danskin. I got this one in a 30/60 because people online were saying that the band ran like a size too small. So I got a 36, and hopefully that's okay. And then like, especially since they might be a little more, or I'm going to be more swollen right after anyways, it should fit fine, hopefully. Fingers crossed. It wasn't the most expensive sports bra, so if it doesn't, then I'm only out like $12, I think. But yeah, so I got that to wear while the other one's in the wash. Anything else that's important? I'm not taking my Lithium the day of because I can't have any food or drink or water or anything before, or like after, the paper says after midnight, but the nurse was saying after, like before 8 hours. So I still don't know the time of my surgery, but I also don't want to get up at like, she says that they usually start in the afternoon, and I also don't want to get up, like even if my surgery's at noon, I don't want to get up at 4 in the morning just to take my Lithium. So I think I'll be okay if I skip one dose and just take it that night, because I take the majority of my daily dose that night anyways. I'm trying to remember if there's anything else important. I still don't have my surgery time. I don't get that until 3 days before surgery, which, since it's on a Tuesday, means I'll either get it, today's Wednesday, so I'll get it tomorrow or Friday, I'm guessing, depending on if they're like, if it's like business days. I think that's it. As for like who's taking care of me and shit, my mom and my fiance are taking care of me. My fiance got a paid day off work, actually, offered to him before summer hits, so he went ahead and chose his day off for the day of my surgery so that he can go with me. My mom's going with me. My mom's gonna stay with me for a couple days to like help me out if I need it when Trevor's at work. And yeah, that's pretty much it. I think that's it. I think that's everything I need to do except for show you before pictures. Alright, so this is what they look like from the front in a bikini. This is what they look like from the side. There's really not much going on there. Yeah, so I'm not really happy with my cleavage or lack thereof. I'm also obviously not happy with the size. From what he was saying, my cleavage is going to be something like that when all is said and done, which I am cool with. And yeah, I'm excited. Hopefully this bikini top will I'll still be able to use this for my after, but because it's not too tight. I mean, like it feels really tight when I wear it already, but so that is the before. But yeah, I'm so excited. I don't think this will be going up until tomorrow, aka Thursday. So by the time you see this, if you see it on the day it comes out, I'll only have 5 days left until surgery. And I'm so excited and so nervous, but I'm so happy that I'm finally getting it done. And since I've worked the last 7 days now, 8 days? Yeah, I've worked the last 8 days, and I still work until today up through Sunday. So after 13 days in a row, I'm going to enjoy that week off that I have to recover. So I will see you guys the day of surgery, because I think I decided for at least the first 4 or 5 days I want to do daily updates, either daily or like bi-daily. Would that be the word? Like 2 days in one video? But yeah, if you want to keep up to date on everything, like up to the minute, you can follow me on Snapchat because I'll be like documenting everything on Snapchat and saving everything on my phone. And I'll have that linked or listed somewhere in the video, and it's always listed in the description box below, along with the rest of my social media. And I will see you guys in 5 days. Bye!